Well, here we are in 2011 in Birmingham city centre. The UK currently has the highest drug-related death rate in Europe, has done so for many years now. We know that over half of Birmingham injecting drug users are hepatitis C positive. If you look at the state of this place, the aim of this video is to highlight the problem we have in this city.
You wouldn't want to see a dog in here, let alone a human being, to be taking drugs like this. You know, if you're going to do it, give it a place to be, a nice clean environment, somewhere where they can get help.
It's a disgrace, isn't it?
It's a disgrace, isn't it?
Yeah.
Absolutely. In this day and age.
It's only making people worse, isn't it? To come here in the first place.
This is a problem also for the Environment Secretary.
Absolutely.
The Health Secretary.
Yes.
These are the guys that need to get together, sit down with local communities in every major city in England and figure out and work out a situation. Because, This is preposterous.
So I go down into the car parks and into like some of the squats and the archways and stuff like that. Yeah. And we see people like, either shooting up or they're drunk out of their heads, if you know what I mean, drinking away. Yeah. But the filth and the needles that are lying around, I mean, you wouldn't get your breath, you just think, are we living in England? Yeah. Is this England? You know what I'm saying? It's frightening, really. People are in complete denial, aren't they? They don't want to know it's there.
They are, that's right.
Do you know what I mean?
That's right. At the sight, at the mind.
Yeah, exactly.
So,
and then when they do come across somebody that's dead, they're thinking, how did he get here in the first place?
There you go.
And then they frightened and they think there's a human being there that's ended up dead, but how did he get there?
Well,
what are we doing? Or what are the people that's supposed to be paid doing?
Whereabouts do you inject at the moment in Birmingham?
Car parks, anywhere out the way. We're not going to get disturbed because I have trouble getting myself, and I've only got to hear footsteps and I'll just stick it in and get an abscess. And that happens a lot.
The good news is there is a way to address these problems within our communities. For example, there are over 75 drug consumption rooms where people can inject their drugs under medical supervision. Now, these services are proven to not only reduce the harm and the cost associated with injecting drug use, but they also increase entry into treatment, therefore enabling an individual to recover. I wanted to know what a nurse thought of a safe consumption room due to the fact that she deals daily with the consequences of poor and risky injecting behaviour.
And I think, it's very necessary. I think that's a good idea. And I also think that, you would be coming, or you would be meeting people that you would not see otherwise. And we find that, that we have certain people that come and see us, other people you have to go and find them. Yeah. But this would be somewhere in between, I think. So it'd be like outreach extended, because it will be an outreach clinic, but they will be coming there.
I must have had maybe 50 surgeries in my time. I had 30 surgeries in the one sitting, in the one visit to hospital. In the 5 months I was there, I had 35 surgeries, but I've had dozens of surgeries since and previous. The drain I have put on the NHS system maybe might not happen.
HIV infection in Switzerland, in general, is among drug users very low.
HIV dropped very much with harm reduction, and also especially with this needle exchange in the safe injection room, and deaths of the people dropped very much too. And even with this facilities, we integrated a lot of people into treatment, and we have less people using heroin in Switzerland.
Wow. There is no overdose deaths in any of the safe injecting facilities in all of the world.
Clearly the thing that people need is first needle exchange and is prescribed opiate substitutes, methadone, Subutex. But to get to that stage of accepting that treatment, some people are not there. Exactly. And the sooner we can get people into meeting with professionals and getting help and getting advice, the sooner we can help them to move along and stop damaging themselves. Even if they're not ready yet to come into treatment, at least they can get some help and advice, and they can prevent they can prevent infections, they can learn not to damage themselves in the short term, and then in the medium term we can get them away from the damaging behaviour and into treatment.